Tansen Tutimtik, Wagmakantik. Morning, friends, relatives, members, Whitefish Lake First Nation. We are briefly to just talk about a little bit about our COVID program at Whitefish Lake. First of all, before we go on here, on my right here is our COVID support RN. Her name is Kiana. She's from Isle La Crosse. And we just retained her services here just before Christmas, and she'll be assisting us in our Whitefish Lake First Nation as the RN. And it's not, she's connected with FNIB, but not working for FNIB, but is working for Whitefish Lake First Nation. I know back before Christmas, we just received self-testing kits. I know all the homes got one self-testing kit apiece, and now we are doing some demonstrations of how to apply the self-testing kit. We were closed through the holidays, so we were unable to do a demonstration at that time. We done a demonstration earlier this morning with some health center staff and band administrative staff. However, we do have a link within the Whitefish Lake webpage regarding what the demo is, and the demo will describe step by step of how to apply the self-test, COVID self-test. And again, Kiana here will be busy the next week or so, providing assistance in support to program departments, and also assistance to band members of how to apply the testing kit. And she'll be doing some demonstrations. Her schedule will be out here probably within the day, or where the demonstrations will take place and what time and what date. So we just wanted to introduce to you our new COVID support RN, Kiana. Kiana, you want to say hello?
Yes, hello everybody. I'm excited to work and meet with you all. If you guys have any questions regarding the program, don't hesitate to call the health center and ask for me, and I'll do my best to answer any questions.
Thank you very much. In closing, we know that we're very fortunate to have additional staff, and we just want to remind you all that Omicron is here, and again to remind you that Omicron is very rapid, very contagious, and we want to ensure that everybody is safe, and these self-testing kits are available for your use, and to ensure safety for yourself and others and your family. And further to that, self-testing kits and other support safety apparatuses will be provided for school, for busing, and also for Pecan School. So we know that we are opening all our programs in Pecan School and daycare administration offices come Monday, January 10th. We will closely monitor as things progress here and how Omicron progresses in our community. So we'll keep you updated as to how we will be moving forward. Thank you very much. Aye.
This is a demonstration of how to perform a rapid response COVID-19 antigen rapid test. The test kit contains a test device, a sterile swab, a tube stand, an extraction tube, a nozzle with filter, and an extraction buffer. A clock, timer, or stopwatch is required for the test but is not provided in the kit. Bring all testing materials and specimens to room temperature before use. Open the pouch and lay the test cassette on a clean, level surface. Label the device in a clean extraction tube with patient identification. After labeling the tube, place it back onto the tube stand. Gently mix the extraction buffer. Add 10 drops of buffer to the tube. Avoid touching the tip of the buffer bottle to the tube. Have the patient blow their nose with a tissue before specimen collection. Remove the swab from the packaging. Avoid touching the tip to any surfaces, including sterile gloves. Tilt the patient's head 70 degrees. Insert the swab at least half an inch inside the nostril. Swab the nasal orifice for at least 5 seconds using a circular motion. Press the patient's nostril against the swab. While the swab is compressed, rotate the tip for at least 5 seconds. Repeat the procedure with the other nostril using the same swab. Swab the nasal orifice for at least 5 seconds using a circular motion. Press the patient's nostril against the swab. While the swab is compressed, rotate the tip for at least 5 seconds. Process the swab as soon as possible after collecting the sample. Insert the swab into the extraction tube. Tilt the tube so that the entire swab head is submerged in the solution. Mix well and squeeze the swab 10 to 15 times by compressing the walls of the tube against the swab. Place the tube with the swab back onto the tube stand. Set a timer. Let the solution stand for 2 minutes. Pinch the swab in the tube to squeeze as much liquid as possible out of the swab. Remove the swab and dispose of it according to your appropriate biohazard waste disposal protocol. Securely place the nozzle onto the tube. Carefully invert the tube and add 3 drops of the solution into the sample well. Set a timer. Read the results at 15 minutes. A positive result shows 2 lines, a line in the control region, C, and any visible line in the test region, T. A faint line in the test region is also considered to be positive. A negative result shows 1 line, a line in the control region and no apparent line in the test region. An invalid result shows no line in the control region. The results from a test that has not produced a control band at the specified read time must be discarded. Please review the instructions and repeat the procedure with a new test. If the problem persists, discontinue using the kit immediately and contact your local distributor. Thank you for choosing Rapid Response.